In West Africa, the largest recorded outbreak of the deadly Ebola virus is spreading. More than 1,400 lives have been lost to a disease that causes horrific bleeding. And now there's a new front. As many as 13 people are believed to have died in the Democratic Republic of Congo, the fifth country to record fatalities. Fear of the virus is driving panic. An Ebola clinic has been attacked. But across sub-Saharan Africa, authorities are moving to protect population centres. And there are hopes of a medical breakthrough after an American health worker was successfully treated with an experimental drug. Africa correspondent Martin Cudahy reports.
Extraordinary precautions are needed to deal with one of the most deadly viruses on the planet. This is the only laboratory in East Africa where you can test for Ebola, and it's in Nairobi. It's a painstaking process, and Dr. Victor Ofula has been following these procedures non-stop for the past week as Africa tries to deal with this terrifying disease.
Isolation would be one of the things that would make sure that it is done well, and all the preventive measures are taken so that the patient does not infect many other people that are either serving him in different ways.
If a patient is suspected of having Ebola, they are brought here to the Kenyatta National Hospital. It's a very basic facility, a tent. And for now, it's the makeshift Ebola screening clinic. 3 patients who flew in from West Africa were detained here while being tested.
If a sample tests positive, it is important to isolate this patient, because one of the things that we know is that some of the relatives or even some of the clinicians can casually handle the patient.
Ebola transfers person to person through bodily fluids. Once someone catches the virus, the symptoms are almost identical to the flu or malaria, but they quickly give way to massive internal and external hemorrhaging. Some people bleed to death from every orifice.
People are really scared. It spreads very, very fast, and you can see the patterns in West Africa where all family members are killed, they die, villages are wiped out, towns are, people run away from those towns. It's a horrifying and scary disease.
Ebola has already claimed well over 1,400 lives in West Africa. The latest country to fight the virus is Nigeria. It's killed 5 people in the chaotic city of Lagos. Some doctors and nurses are now refusing to go to work, and relatives of victims are pleading with them to continue.
Let them have basic treatment. Let it not be as if we all stood there and we just abandon them and then they will die, I'm sorry to say, one by one. Let people treat them, they are human beings.
The worst affected country is Liberia. Fear of Ebola is so great here that a clinic in Monrovia, where victims were being treated, was attacked by a mob. 17 patients fled the violence and returned to their homes, sparking fears of renewed outbreaks.
When the community saw that we were carrying supplies, food and beddings for those people, some young people got agitated and then jumped in that area and scared away those patients.
Across the continent, in East Africa, the Kenyan capital Nairobi usually serves as a gateway for travel to Europe, Asia and the Middle East. But flights from affected countries were cancelled when the World Health Organization said the Ebola outbreak had been vastly underestimated. Passengers have been tested as they arrive. If they have a heightened temperature and have been in an Ebola-affected area, they are taken away for testing. The Director of Medical Services in Kenya denies claims his government did not react fast enough.
This particular outbreak was bigger than we thought. Then we thought we need to take extraordinary measures. That is why we suspended into entry passengers from or en route from Sierra Leone, Guinea and Liberia as one of our major steps to reduce our risk in the country.
Even though the flights have been stopped, the testing continues. So deadly is the disease, health professionals are taking no risks. Samples from all of the suspected cases of Ebola in East Africa have been brought to this laboratory for testing. While none of them have returned a positive result, that doesn't necessarily mean that Ebola is not in Kenya. Because of the extended incubation period, sometimes as long as 3 weeks, someone could have the virus and not even realise it. That's one of the reasons borders remain closed and flights are still cancelled. It's now a difficult task to travel to West Africa, but health professionals still have to get access to the affected areas.
It's heartbreaking. For being involved in infectious diseases prevention and control for years, what I'm hearing on the news, what I'm reading is, and the conversations that I'm having with colleagues in West Africa, it's absolutely heartbreaking.
Gavin Macgregor-Skinner is an Australian expert in public health and emergency responses. He's now based in Washington DC but is preparing to leave for Nigeria. He says technology is making a big difference in how quickly authorities can react.
So we're finding that if we use all the tools in the toolbox, and the greatest tool we have even before we leave has been video conferencing on our cell phones, then that's going to help us help the people and beat the Ebola virus.
He's heartened by the case of 2 American health workers who beat Ebola after being given an experimental drug.
Today is a miraculous day. I'm thrilled to be alive, to be well, and to be reunited with my family.
We know that we can beat this Ebola virus very easily, and we know we can do that through the training that I've received, the experiences I have. I know that myself and my team are able to go out there and help people and ensure that this doesn't stay around for much longer.
Martin Cudahy reporting, and that's the program for tonight. We'll be back at the same time tomorrow, but for now, good night.